What is the recommended first medication for a patient in pulseless ventricular tachycardia after initiating CPR and defibrillation? A. Amiodarone. B. Atropine. C. Epinephrine. D. Magnesium sulfate. Answer: C. Epinephrine 1 mg 4/IO is given every 3 to 5 minutes during cardiac arrest, regardless of rhythm type, to increase coronary and cerebral perfusion. What is the maximum time allowed to check for a pulse during a cardiac arrest assessment? A. 5 seconds. B. 10 seconds. C. 15 seconds. D. 20 seconds. Answer: B. Pulse checks should be limited to 10 seconds to avoid delaying chest compressions. Which of the following best defines PA, pulseless electrical activity? A. Shockable rhythm with pulse. B. Organized rhythm without a pulse. C. Ventricular fibrillation with no output. D. Sinus tachycardia with hypotension. Answer: B. P is a rhythm that appears organized but there is no palpable pulse. It requires CPR and treatment of underlying causes. Which of the following rhythms is considered shockable? A. Asystole. B. P. C. Sinus bradycardia. D. Ventricular fibrillation. Answer: D. Only ventricular fibrillation and pulseless ventricular tachycardia are considered shockable rhythms in ACLS. During a code, a team member begins defibrillation while compressions are still in progress. What should be the immediate action? A. Continue compressions. B. Stop compressions and deliver shock. C. Give epinephrine. D. Deliver synchronized cardioversion. Answer: B. Compressions must be paused briefly to safely deliver a defibrillation shock, ensuring no one is in contact with the patient. How often should advanced airway ventilation be provided once the airway is secured? A. 1 breath every 3 to 5 seconds. B. 2 breaths every 30 compressions. C. 1 breath every 6 seconds. D. 10 breaths per minute with pauses. Answer: C. With an advanced airway in place, 1 breath should be given every 6 seconds, without pausing chest compressions. What is the recommended first drug for symptomatic bradycardia? A. Adenosine. B. Amiodarone. C. Epinephrine. D. Atropine. Answer: D. Atropine 1 mg for every 3 to 5 minutes, maximum 3 mg, is the first-line drug for bradycardia in ACLS. In which situation should synchronized cardioversion be used instead of defibrillation? A. Pulseless VT. B. Asystole. C. Unstable SVT. D. P. Answer: C. Synchronized cardioversion is indicated for unstable tachyarrhythmias with a pulse, like unstable SVT. Which action should be performed immediately after delivering a shock to a patient in VF? A. Check pulse. B. Administer amiodarone. C. Resume chest compressions. D. Provide rescue breathing. Answer: C. High-quality chest compressions should be resumed immediately after shock delivery without checking for a pulse. What is the dose of amiodarone for refractory VF or pulseless VT? A. 150 mg for once. B. 300 mg for push, then 150 mg. C. 1 mg per minute for 6 hours. D. 2 mg for bolus. Answer: B. The first dose is 300 mg 4/IO push, a second dose of 150 mg may be given if VF/VT persists. Which of the following is a reversible cause of cardiac arrest? A. Bradycardia. B. Hyperkalemia. C. STEMI. D. Cardiomyopathy. Answer B. H's and T's represent reversible causes. Hyperkalemia is one of the treatable H's. A patient is unresponsive and gasping with a pulse. What is the next best action? A. Begin CPR. B. Deliver shock. C. Provide rescue breathing. D. Check blood sugar. Answer C. For a patient with a pulse but abnormal breathing, provide rescue breaths every 5 to 6 seconds. Which medication is most appropriate for a stable patient with regular narrow complex tachycardia? A. Amiodarone. B. Lidocaine. C. Adenosine. D. Epinephrine. Answer C. Adenosine is the first drug of choice for regular narrow complex SVT. What is the preferred method to confirm ET tube placement? A. Chest movement. B. Bilateral breath sounds. C. Colorimetric CO2 detector. D. Continuous waveform capnography. Answer D. Waveform capnography is the gold standard for confirming endotracheal tube placement. A patient with ROSC is not following commands. What is the recommended intervention? A. Give aspirin. B. Initiate targeted temperature management. C. Provide defibrillation. D. Begin chest compressions. Answer B. Patients who remain comatose after ROSC should receive targeted temperature management. During CPR, what is the ideal chest compression depth in adults? A. At least 1 inch. B. At least 2 inches. C. At least 3 inches. D. 1.5 inches. Answer B. Compress at least 2 inches, 5 centimeters, deep to ensure effective perfusion. Which ACLS drug can cause flushing in brief asystole? A. Adenosine. B. Amiodarone. C. Epinephrine. D. Lidocaine. Answer A. Adenosine often causes transient heart block or asystole after administration. Which of the following is not part of the H's and T's of cardiac arrest? A. Hypoxia. B. Hypovolemia. C. Hypertension. D. Tension pneumothorax. Answer C. Hypertension is not considered a reversible cause of cardiac arrest in ACLS. Which monitoring parameter best indicates the quality of chest compressions during CPR? A. Respiratory rate. B. Diastolic BP. C. End tidal CO2. D. Oxygen saturation. Answer C. An EtCO2 value of greater than 10 mm of mercury suggests effective chest compressions. Which drug is used in torsades de pointes with prolonged QT interval? A. Atropine. B. Magnesium sulfate. C. Epinephrine. D. Amiodarone. Answer B. Magnesium sulfate is the drug of choice for torsades de pointes, especially with a prolonged QT interval. A patient in ventricular fibrillation is unresponsive to the initial shock in 2 minutes of CPR. What is the next best step? A. Administer epinephrine 1 mg 4. B. Deliver a second shock immediately. C. Administer amiodarone 300 mg 4 push. D. Check for pulse. Answer A. After the first shock in 2 minutes of CPR, the recommended next step is to administer epinephrine 1 mg 4 every 3 to 5 minutes. Amiodarone is reserved for later if the patient remains in a shockable rhythm. During resuscitation, which ECG rhythm requires immediate defibrillation? A. Pulseless electrical activity, PA. B. Ventricular fibrillation, VF. C. Asystole. D. Sinus tachycardia. Answer, B. VF is a shockable rhythm and requires immediate defibrillation. PA and asystole are non-shockable rhythms and are treated with CPR and medication. What is the most appropriate airway management method during CPR for a patient with a pulse and agonal breathing? A. Perform immediate endotracheal intubation. B. Provide rescue breaths using a bag valve mask. C. Administer epinephrine 4. D. Deliver a defibrillation shock. Answer, B. A patient with agonal breathing and a pulse needs ventilatory support. Bag valve mask ventilation is appropriate while preparing for advanced airway if needed. In an adult bradycardia patient with a heart rate of 40 bpm and altered mental status, the initial treatment should include A. Immediate defibrillation. B. Administration of atropine 1 mg 4. C. Observation only. D. Synchronized cardioversion. Answer, B. Atropine is the first-line drug for symptomatic bradycardia. If ineffective, transcutaneous pacing or dopamine/epinephrine infusion may follow. A patient suddenly becomes unresponsive, pulseless, and apneic. The ECG shows a wide complex tachycardia. What is the first intervention? A. Perform synchronized cardioversion. B. Begin CPR and deliver defibrillation. C. Administer adenosine. D. Perform endotracheal intubation. Answer, B. A pulseless patient with a shockable rhythm, likely VF or pulseless VT, requires immediate CPR and defibrillation, not synchronized cardioversion or adenosine.